Hi there. I'm going to give you a quick overview of the changes that have happened to Luma Health in the first quarter of 2018. I'm going to give you an overview of custom actions changes, new referring provider pages, and some of the new languages we're translated into. So here I am in Luma Health, and I'm going to click over here to Actions. And the first thing you'll notice is we've redesigned the custom actions page to be a lot cleaner and a lot simpler. You can click over here to create new actions, such as actions based on appointments, based on recall messaging, procedure follow-up, that's for things like CPT codes, diagnostic follow-up for when a patient has a ICD code that you'd like to message them about. You can even add an extra reminder. Maybe you want to send something specific for one specific provider when he's only working at a specific facility, or you can clone an existing action. To show you how these work, I'm going to load an example set. We now ship with a set of examples for specific medical specialties. I have cardiology and GI here, so let's just pop into cardiology for this example. So let's say I want to send a stress test message based on the appointment schedule. So in this example set, I have stress test 4 days prior. I'm going to click into that to give you an example of how our new custom actions editor works. So here I am inside the new stress test 4 days prior message. It's currently disabled, that's great. And here's the message. What I want to do when this happens is I'm going to message the patient with this message. We're looking forward to seeing you at your upcoming cardiac stress test. For more information on this exam, here's a link. Really helpful if you want to send information such as preoperative, pre-procedural information. You can also edit it, say, at facility name. So you can automatically start building out these templates. You can always work with our customer success team as well to make this happen. And secondly, you choose the timing. So I want to send this message 4 days before the appointment time. Now I can also send this to 4 days after the appointment time, which might not make sense for this specific message, but you get the idea. Lastly, what you have here is the appointment filters. The appointment filters let you really dial in exactly how you want this message to get triggered. So I can say only for confirmed appointments with the new patient type, and of course this is synchronized to your account in Luma Health at provider Dr. Brian Anderson, and you'll get an impact preview here. So in my test account, 0 patients will be affected by this custom action, but in here will be an example of which patients are impacted. So that gives you a good little overview of the new changes that we've got to custom actions here. If you have any questions with these, feel free to play around with them or get in touch with us at support@lumahealth.io. Now, moving on to the next new feature. Over here are our new patient referral forms. For practices who use Luma's referral product, we want to take out a lot of the paper steps. So our new patient referral forms are something that you can put on your website, your clinic's website, so that your referring physicians can send you referrals. So here I am as a fictitious provider, John Smith, and I'm sending a referral over to my fictitious clinic, Aditya Bansod. You can type in the patient's name, first name, date of birth, phone number, what provider they're being referred to see, which facility they're being referred to see, and any notes. Once these come in, so I'll give this a quick shot. Let's say I'm referring myself. Let's say I'm born 12/12/1912. I need English communication, and my phone number is 415-555-1234. No need for an email if I don't have it, and I'm coming to Hayes Valley Health. I'm going to send those over. Boop. You've submitted one pending referral. Now, if I pop over to Luma, you'll see at the top of your activity feed is these new pending referrals. I could go ahead and review them, and I can say, all right, this one needs approval, and you know what? I actually don't want to see that patient. It doesn't meet my standards, or I can't support their insurance or whatever it is, so I'm going to go ahead and reject that. And then as soon as you mark them as approved, you'll start the standard Luma patient messaging. So really handy way for you to get the paper steps out of the way in order to start getting those referrals messaged and scheduled into your clinic. The third and last thing I want to show you is a couple of the new languages that we have supported in Luma Health. We now support 9 different languages, including Arabic and Haitian Creole. So you can always take a look at the templates, see what they look like here. And here's Haitian Creole, so you can take a look, edit them if you wish. And that adds our list of supported languages from English, Spanish, Vietnamese, Korean, Russian, Farsi, Simplified Chinese, Armenian, and now Arabic and Haitian Creole. Hope you enjoyed this quick little overview of what's new in first quarter for Luma Health. We'll be doing these update videos at the end of every quarter so that you get an opportunity to see what's new in the product. Thanks so much, and if you have any questions, as always, support@lumahealth.io. Thanks, and bye.